If you notice that you're shedding a little bit more once or twice during April or May, it's okay. But when you start to see the third case of shedding to where you have handfuls of hair in your shower, in your tub, on your pillow, and someone says, oh my gosh, there's hair on your shoulder. After the third notice of that, you need to take heed because something else is going on. And so the vanity piece, not kick it out of the way. I mean, it's ridiculous, absolutely ridiculous.
So you guys, today I have a very exciting guest for me personally, and I'll share a little bit about the why, like I always do. But it's Kimberly Vaughn. She is a board certified clinical trichologist. You're going to ask me what's a trichologist, guys, and we're going to talk a lot about hair and scalp. She has been dedicated to the study of hair and scalp for over 25 years. She is the founder of HPIHair Partners. And Kimberly has treated thousands of clients using trichological paramedical approaches. We're going to talk about what is a trichological paramedical approach. But Kimberly, thank you so much for coming and talking to me today because our community has so many questions for you.
Oh, great. Well, Haylie, it's such a pleasure to be here because your community is vast and we love to help and offer recommendations and suggestions. And, as we know, hair loss and scalp care are always top of everyone's mind because that's what we see when we first look in the mirror and we see ourselves, right? So I'm glad I'm able to help.
I'm so glad. A lot of people know, I have a background in agriculture and soil sciences. I'm also an avid horsewoman. I have cattle. It is always so crazy to me that there's such a disconnect between our hair and scalp health in the human species. Mm-hmm. Yet with our horses, with our cattle, like the very first thing we look at when we're assessing the health is we look at the coat, or in our cases in this species, the hair and the scalp. And it guides how we look at the body, pathologically, genetically, from, parasite or bacteria or viral even, and for sure, nutrition. So it's really cool. And there's more women coming into this conversation. I think, I don't know, but at least 25 years ago when I first started, it was a real male conversation, but women are talking about it. So I'm really glad you're here, and our community had a lot of expression. So I have to ask though, how did you get into this field?
And I'm going to make this short because it's a little bit of a long story. I actually started into the field of trichology through the chemotherapy and radiation therapy hair replacement side. I had a very dear friend that was undergoing chemotherapy, and she was very young. She was only 24. And they found her breast cyst when she was trying to nurse with a newborn in the hospital. And so that's how they determined that her breast cancer had already magnified and had spread beyond an early stage. And so because they were so radical with her treatments, she lost her hair straight away. And so I reached out to friends and said, look, I know nothing about wigs or prosthetics, but let's see if we can help her. And so that's how it started. The interesting thing was, though, at that particular time, Haylie, we were working on a reactive approach, right? We were waiting specifically for the drugs to take effect, and then they had to get deeply into the system and into the body. And then from there, we had to treat the symptom or the reaction of the drugs. Now we take a very different approach with HPI's preservation and proactive treatments. Even for chemotherapy patients now, we start our treatments even before the hair starts to shed and before the hair starts to fall out. So it's all packaged together, but now luckily we're able to work harder on the preactive and the proactive side than we are on the reactive.
That's cool. I had no idea that's how you got into this. I had one of my really good best girlfriends go through breast cancer. She was nursing her babies. I was nursing my babies. And that's actually how I came up with our 10-day food-based and shake-based detox program.
Wow.
So it was the inspiration for me of watching individuals go through what for her at the time was necessary, but how to help her body to prepare for that, chemo insult, and how to recover and rehabilitate after. So I had no idea, but isn't that amazing? I mean, it completely changed the trajectory of what I was doing 20 plus years ago, many moons ago in clinics. So, but you bring up something, which is, our community always says, what do we do from a preventative versus from a proactive perspective? I had a ton of hair. I watched clients go through this, but it wasn't an issue that I was faced with until I got sick. I got really, really sick. I was in the hospital at UCLA for about 3.5 weeks. Sometimes went through sudden menopause, just boom, like hit me. Never had another period again, and just completely started losing hair. And I just panicked and freaked out, and really looked at what was going on in my body and my body's immune system, and had to kind of research and just cobble stuff together. I wish I knew you then, because it was quite the journey. So can there be? I know that with chemo we can talk about a sudden event, and I see behind you, and I love the fact that there's genetic testing and epigenetic analysis, but is it a combination of things that causes it? Like, I always think mine was a little bit the perfect storm, right? I had a massive infectious component, massive fevering, and then, had what they call premature ovarian failure, because I halted my periods due to having that infectious meningitis event. But I was just like, it was just crazy for my body and what I went through.
Well, and so I'm going to take you back a moment. When you started our discussion, we started talking about your horses, and we started talking about the coat. Then you went directly then over to speaking about how that you were able to develop your first line with your friend when you all were nursing and going through breastfeeding. And when you see postpartum hair loss in that case. But the number one thing is you looked back at your health. You looked back internal in both of those cases. And so that's what I want your listener to really gain so much from our takeaway today, is that you have to start deep rooted into the body, which then takes you deep rooted into the hair follicle. Then to answer your last question is, you had a perfect storm. That's not an anomaly. Many times people have perfect storms. And this is the reason that we see so much hair loss, aggressive, fast, as somebody in the medical field would say, very acute. Yes, that's right. It doesn't always turn off and on, though, when the stressors turn off and on, because the body, right? Yeah, that's right.
No,
that's right. Because it takes the body for a long time to recover.
Right. And sometimes the follicle can be damaged too. Is that correct?
It can. That's a whole different set of circumstances, typically, unless you have a trauma to the actual follicle itself. We typically see that from a type of a chemical reaction, or we see it from stress on the hair itself. So when we talk about trauma and stress with heavy braids, heavy ponytails, for our beautiful African-American sisters in the world and with us today, so many are going more natural for men and women. And it's because of this reason that we can really slow down that loss in our African-American population when we find that we're not causing that trauma on the follicle day after day, week after week, month after month. So
I always talk about the metabolism and that everything in the body is nutrient dependent, right? In the agriculture space, hoof and coat are almost tertiary, the third most important thing in the body. Like, to keep the body alive, we have to feed the brain. To keep the body alive, we have to fuel the heart. That's why, and control our blood flow. And oftentimes when the body's under tremendous stress, it will not take care of hair, skin, nails, scalp. Is that pertains to, I see it in the human, but I see it
100%.
And so how does what we eat, we always say that the hair is that reflection. It's looking out and checking. But how does what we eat impact our hair growth?
Right. So similarly to what you were talking about coat, right? And hair and nails and skin. So when we think about our hair, skin, and our nails, they're made of cells. And so when we are talking about nutrients, whether it's macronutrients, micronutrients, or vitamins, minerals, whatever you want to build into this category. And I know that so many of your programs focus on different areas of these, Haylie, depending upon any deficiency in the body. So first of all, we need to understand, what is that deficiency? Right. So if you are someone that's been ill and had trauma due to a major illness and we're in the hospital, your deficiencies will probably be different than a postpartum mom. They also might be different from a menopausal woman and also from a male, and I'll throw a ringer here, that could be experiencing genetic hair loss, but also has an undiagnosed thyroid.
Right. Thyroid. Hello.
Yeah, that's right.
We should have just a thyroid conversation. Maybe
yes.
I want to ask, give me maybe the top 4 or 5 reasons or episodes that we see hair loss happen. I know you mentioned genetic. I mentioned like infection. We mentioned, through chemo. I heard the word menopause. When do we see the transition or hair loss be? Just because it's common doesn't make it normal. So I don't want to say normal, but when we commonly see it.
Well, I think you're going to commonly see hair loss when the body has a stressor that's impacting the system, right? So what does that mean and what does that stand for? So we can go back and look at all of the items that you just listed, right? So you have genetics, you have a thyroid disorder, you have hormone imbalance. Then you have major trauma on the system, such as an illness, a high fever. I mean, I could go on and on. There's 18 classified actual hair loss causes.
Oh, wow.
There's 18. And so, but most people have only heard of 3 or 4 of them. There's truly 5 on record that we predominantly talk about. And those are the ones we just discussed with the genetic, the medical. When we're talking about autoimmune, we left that out. And that's really important because if you're not seeing your body build these micronutrients and these trace metals and minerals in the amino acid world, right? We're also seeing some issues many times within amino acid weakness and deficiencies.
And so we have a lot of individuals that have Hashimoto thyroiditis. I have ITP, which is an autoimmune disorder. We have a lot in our community that have lupus, Crohn's, MS, and there seems to be a large component of hair loss associated with that. We focus so much on those individuals. We really focus on the gut and the absorption of nutrients, because sometimes we can take nutrients, but if we don't actually deliver them either through the blood cells and our immune system doesn't inhibit that, but the other is just the sheer absorption and conversion of that. A big question is did you see it coming when COVID hit? Did you see that we would have COVID hair loss? Like women and men talk about that so much in our community, just clumps of hair coming out when they had COVID.
Right. And it hasn't gone away completely. So no, did the trichology world or the hair loss world see this coming? No, we didn't. However, when we started falling into the high fevers that we were seeing with the condition, when we started seeing the lingering cough, when we started seeing the lingering chest contractions, right? We knew that this was coming. And so acute hair loss with COVID-19 was one thing. But, we're now years past and we're still seeing this chronic issue of either calling it long haul COVID or calling it, an offset of something that happened when the virus was active in the system.
Hi, it's Haylie, your host. I know firsthand what it feels like to find real impactful solutions to your struggles. and I know what it feels like to lose hope. We are being bombarded by toxins every single day. As a matter of fact, the world's largest single environmental health risk is air pollution. One thing that is becoming crystal clear is that environmental toxic burdens in our bodies must be addressed. Let me help you tackle toxic burden. Go to HayleyPomroy.com/detox and download my free Detox Decoded Masterclass. Let's give you a fighting chance. I know what it feels like to lose hope, whether you're dealing with fatigue, mast cell activation, an autoimmune disorder, long COVID, viral reactivation, anxiety or depression, or inflammation. All of it can feel overwhelming. I will teach you nutrition and natural therapies to help your body eliminate toxins. I cannot wait to see you there. Again, that's HayleyPomroy.com/detox.
We just actually hosted a conference at the Institute. I'm at the Institute for Neuroimmune Medicine, and part of the whole conference was on long COVID. And I was so excited that I was going to be interviewing you because they were talking about the nutrient consumption of how the immune system responds to the spike protein. And we're taking it back. And that there is such a demand for vitamin D. I made a list: A, D, E, zinc, iodine, and selenium are ravaged, are consumed at such a high level when the immune system has a response to this particular type of virus that, and some of the immunologists were like, oh, we knew everybody was going to lose their sense of taste. And because it consumes so much zinc and where we store our zinc in our product line, oh, we knew. And I said, did you see the hair loss coming? And the immunologist said, there is a component that mirrors the immunological response in a chemotherapeutic patient with gut and gut receptor sites. And I just was like, it was like mind blown. So how I'm going to just stay with our long COVID I'm going to call it long COVID if we're still having hair loss community for a second here. How are we tracking or mapping that? Do you physically track the hair loss? Do you talk to them about, I brush my hair and so much is coming out? I got the tons of the baby, I call them angel hairs, but tons of the baby hair with hair growth, regrowth after having the hair loss around COVID.
Right. So in our clinic and trichology clinics, yes, we will always start with a baseline of when we first meet with the patient and the client. At that point, we take a magnifying view, if you will, of the scalp, and we either call those dermoscopes or trichoscopes. And so it gives us a baseline of where we are at the time that the patient starts treatment with us. And then we map those throughout the course of treatment. I mean, we're treating clients for 10 years. So we're able to see what's happening with that growth. And we're also able to see the diameter and the density of each hair as well. So that's the key, is for anyone listening, if you're running into kind of a roadblock, you're not getting anywhere, right? You need to find a support team, whether it's a trichology team or a dermatology team, that will truly monitor your progress so that you have a baseline to start with. And then as you perform treatments, whether they are supplementation, diet, topicals, oral medications, stimulations, injections, whatever that you're going to be performing to re-stimulate the growth, then you need to make sure that it's working.
Well, I love what you just said, because one of the reasons I wanted to have you on was because there's a stigma, I think, sometimes associated with getting help with this particular issue. A lot of the women that I talk to in our community feel bad or feel like it's a vanity play, right? To address this issue. And I'm like, no, it's your body talking to you. It is an expression of other things that are going on in your body from a health perspective. It was easier for me early on in the autoimmune space to talk to my alopecia patients about that, right? Because I feel like a lot of their doctors will embrace seeing, it was the first time I heard about trichology was when I was in the autoimmune space and working with alopecia specifically. And it was to bring in a trichologist and look at the genetic expressions, the absorption and absorbability, the nutrient dependencies. We could really help with an anti-inflammatory food protocol, things that we can employ. But then we go to our pre-menopausal women, and they try to talk to their docs sometimes about this. And the doc just says, this is just what happens in menopause. And it breaks my heart.
Mm-hmm.
I don't think people know that they can have you as a resource, or they can have this as a resource. Can you talk a little bit about getting people out of the mindset that this is a vanity?
Well, I mean, you did a great job and a great intro for me. So I think at the end of the day, when something in your system is not moving in a positive direction, meaning if you see a skin color change, if you see a change in your nails, if you see a change in your body weight, whether it's losing weight, gaining weight, whether it's that you feel bloated or you feel puffy or you're allergic or you're having sinusy issues. And certainly those are going to vacillate during the times of the year. That's one of the reasons that we talk about, seasonal shedding, because it is real. It's so real, right?
Is it normal?
Oh, yes, it is.
And it's okay? Okay.
Well, I mean, what's okay, right? I mean, so it depends. If you're shedding 1,000 of hair a day, then no, it's not okay. If you notice that you're shedding a little bit more once or twice during April or May, it's okay. But when you start to see the third case of shedding, to where you have handfuls of hair in your shower, in your tub, on your pillow, and someone says, oh my gosh, there's hair on your shoulder. After the third notice of that, you need to take heed, because something else is going on. And so the vanity piece, not kick it out of the way. I mean, it's ridiculous. Absolutely ridiculous. You should never think that.
I know, but so many people in our community feel that way, and they feel a little bit gaslit or shamed by their practitioner when they come in and talk about it. So this is what I tell them. And so I had that tremendous hair loss, and it was, I should send you pictures. It was handfuls and handfuls and handfuls, and it went on for months and months and months. And so I went back and brought some chemists in and started formulating and making a supplement, because I thought, okay, how can I hyper nourish? How can I feed? How can I help metabolize the hormones associated with, I was just looking at all the metabolic pathways and what I could do. And if it was just a vanity thing, and I started consuming those, and obviously my hair all came back, thank God, I'm so glad. And it grows like crazy. And my hairdresser keeps telling me to stop taking T4, T3, which is what I take. Stop taking it because, But I said, look, it was physiological in my body. And if I can help you not feel bad for getting help, please. I didn't really want to talk about it, honestly, because it was really, I don't know, it was just very shocking. And it was something I wasn't able to really will away or control or meditate my stress down, or, what I mean? I wish it away. I'm a super positive thinker person. I had to actually attack the chemistry and the biochemistry of my body and heal the metabolic pathways that had gone awry during that episodic. And now being a postmenopausal woman, learning how to support myself. So I like, all these questions keep coming through my head. I have a question. Why is the crown so affected with hair loss?
Well, let's define the crown. You're pointing to the top of your head. The crown is back here. So tell me which one.
Why? Well, women talk about the top of their hair thinning, right where you would put your part.
Yes. Okay.
I wanted to steal you away. So I had prednisone, tons of prednisone with my autoimmune disorder before I got well. So I naturally have a gray, I lost all the coloration in part of, if my community knows this, in part of my hair at the age of 19, stayed that way forever. The cool thing about hair loss was those follicles just fell out like crazy. I mean, it wasn't great because I had no hair, but I guess I didn't understand when women are going through it, are there different areas that is lost more significantly?
It is. You covered a lot. Let me see if I can back up a little bit.
So, no, very often.
It's okay. It's okay. So first of all, the medication that you were taking causes a different tone in the color because it affects the medulla in different areas of the hair itself. And so that will affect the hair color. When you mentioned that the hair follicles fell out, the hair strands fell out because if you lost your follicle or a follicle died or completely dilapidated, right, which will, if it is non-active for 10, 20, 30 years, we really don't know the actual time. Because if the body is stimulated, and now talk about healing your body, right, with what you were doing, when you start to heal your body from an autoimmune environment and toxicity, then is that also going to help in other areas of the nutritional respect, right, that your body also needs healing? So all of that said, does that matter, or does it dictate where the hair loss is happening on the scalp? No. And especially for women, we have a tendency to find that we're involved in two forms of hair loss. One is actually labeled male pattern thinning because it's from the top or the front of your hairline to this crown area.
Okay.
The second form of hair loss is female pattern thinning, and that is typically anywhere around the perimeter. So you can start thinning from the frontal hairline and it will gradually move all the way to the crown. Female pattern thinning, however, many times will start in the nape of the neck. So you will start to see thinning at the nape. And so many times people say, why is my ponytail getting so small and so skinny? Well, it can be because you're putting too much traction on your ponytail, but it can also be because there's a female pattern thinning situation that's going on. And yes, there's a school of thought that says when we see more female pattern thinning, that we can be moving down the autoimmune road closer, right, and more parallel. However, that there is no science that dictates exactly behind that until you start moving into alopecia areata, alopecia universalis, and alopecia totalis.
Okay.
Which are full-blown autoimmune forms of hair loss.
That attack from an immunological perspective, they actually attack the follicle itself. Is that correct?
They attack the follicle itself. Your body tells itself to stop growing hair. And we don't know why. Now, what has been a revolutionary invention and finding is that in the last 2 years, we've seen a big change in the way alopecia areata is being treated because of JAK inhibitors. Now, there are certainly side effects to JAK inhibitors. And so many times when people are diagnosed with alopecia areata, they're young, 3 years old. We've treated a sweet little boy who was 3 years old who had areata. To have an individual at that age on a JAK inhibitor and on a heavy duty medication, most parents are not going to say, yes, I approve of that. Right. As individuals get older and they have the reoccurrence of areata to where, and when we talk about alopecia areata, right, for your listener in your community, we're talking about loss in small sections and spots throughout the head. Yes, over time, those spots can connect and conjoin. So then you have even more loss, but it truly is a diagnosis of areata, spotting of hair loss versus hair loss from the neck up, or hair loss versus from the top of the head all the way down to the tip of the toes.
So if I go back to our listener right now, can you give me some ideas of things that you can recommend? I want to first go with hair growth, just the average everyday person that is saying, I not necessarily want to reverse my loss, but just what can help me have better hair growth?
Great question. And the easiest answer for that is that if you just want to see additional hair growth, it's stimulation, stimulation, stimulation. Oh. So the more that you massage and stimulate the blood flow and the circulation, therefore oxygen in and around the scalp and in and around the follicles themselves, you will see a more fluid growth to the hair.
And do you put anything, like a lot of people use a rosemary extract? Do you suggest putting anything on the scalp topically? Naturally first.
Right. So first, the reason that I said stimulation, stimulation, stimulation is because it is it's a magic potion just by itself.
Right.
There are lots of solutions online, right? Rosemary oil, peppermint oil, caffeine, you name it, right? That you can massage into the scalp. What I would tell you is if the oil is a water soluble type of an oil, right? And so is that a misnomer, right? You're the genius on that. So I'll let you clear the air on that one. But we need to make sure that the oil will penetrate into the scalp and not lay on the scalp, because you can do
kind of oils that you like. Are there any oils that you like?
So
like a base.
Natural, right? Natural. Yeah. So the carrier agent's key, right? And so when you talk about rosemary oil, when you talk about different forms of stimulation, more natural is better, and pure is 100% the way to go. So, you have to know the source of where the oils are coming from.
Yes. I had somebody in our community say, they read some of the ingredients on some of the stuff that that has been suggested at some point. Yes. They said it rivals Roundup, and I said, okay, we'll look into that. So, when I don't know, I always feel we got asked this by our community, and I'm like, it's that comment where people say, when when you how much hair should I be pulling out of my hairbrush on a given week? Is it normal to clean your hairbrush? I use those blow dryers now that have the brush in them. And the other day I was cleaning it out, and I think I have a little PTSD, and I was like, oh my gosh, is this more than normal? Are you looking for just a change in what's your normal? Do some people shed more?
Yes. So great question. What is the normal? The normal is going to vary from everyone. And so just as we were talking about a moment ago, if you typically shower and you shampoo your hair daily and you see 1 or 2 hairs, right? That's normal for you, because Haylie, you have a head full of hair, right?
Right.
And I don't know the density of your hair because I've never examined it. I have a lot of hair as well, because I take T3 and T4 as well. But I have very fine, thin hair. Okay. So my hair is going to look different in a loss perspective than yours is going to. I shampoo almost daily. And so if I lose 1 or 2 hairs, that's a lot for me. Now, if I go through a seasonal shed, I might see 5 or 6. And so if that continued for more than a couple of weeks, then I would be checking myself to say what's going on.
Okay. Ooh, that's a good one. I like that litmus test for us, because I definitely go through a cyclical shed, and I do have a lot of hair now, and I'm very glad that I do. When, at what point, and how does a person connect with you?
Oh, thank you.
What's your ideal patient or client, and at what point? And how do they get you? I get you. How do they get you?
Right. Well, and so we have a brick and mortar location in Nashville, Tennessee. However, we treat patients all over the United States as well as Canada. And so we do work via video and telemed sessions. I was just on the phone this morning with someone in California and someone else in Washington State. So our website it's HPIHairPartners.com. There's a consultation form there, and it's really important if someone lets us know that they're coming from your show. So if they can just type in Haylie or Pomroy or something of that sort, then we are offering a special discounted consultation fee. And so it will allow them to have a full 45 minutes consultation, trichology consultation with us at a discounted fee.
That's wonderful. I did not know you were doing that, but thank you. I'm always trying to pull in favors for our community. You would be amazed. We're like, well, let's make a call. Let's see if we can make this happen. I know that I wish I would have had you at that time. It was not a good time, for sure. But at what point? So someone preparing to go through menopause. So a lot of our women, I will tell you, the biggest thing in our community has been a lot of post-viral hair loss. And we're talking about it a lot right now in our community. And the other, I would say 3 in our community that are we have a lot of Hashimoto's thyroiditis because there is the component of polycystic ovarian syndrome, of insulin resistance with that. And so they seem to migrate to us because all other diets don't work for those people.
Mm-hmm.
You know what I mean? So they seem to land in our world, which we love them up and take good care of them. At what point should they have a consultation? Now, because they're where they're at today. But ideally, would it be, when they first get a diagnosis? Is it part of your self-care as you're going through menopause because it's so common now?
Yes. So all great questions. Let me back up. So when you see this more aggressive hair loss that we just discussed, that is definitely the time that you pick up the phone. Another time when you pick up the phone is that many times when labs are drawn for thyroiditis or Hashimoto's, typically you as the consumer, as the patient, have to push your provider to keep running labs because you're feeling miserable and they're telling you you should feel fine. That your labs are
fine.
Normal. Right. But that's the issue, is that there has to be a comprehensive panel of thyroid labs that are run. And if you're seeing hair loss, you're feeling fatigued, you're gaining weight, you're losing weight, then yes, it's really important to go ahead and seek help. We tell you that it doesn't matter how old you are. I mean, we have clients, as I mentioned earlier, as 3 years old, that will have different forms of loss. When we have an individual who is an adolescent or a teen, typically there are other contributing factors, right, that we're running into. It's certainly not just a straight genetic hair loss. And so then we will start with our testing and our analysis. And the testing and the analysis you mentioned earlier in the show is the epigenetic analysis, the DNA testing, and then we will also send the patient for traditional labs. We're able to work with labs all over the United States. It's great. Because we can just offer a requisition and they can have those drawn. And at least it gives us an overarching overview of if it's a perimenopausal, if it's premenopausal, whatever's going on, then we can see what's happening with those levels.
And
did that answer your question?
Oh, it does. And you just jumped right into the middle of what I was hoping to talk about. So I appreciate it. I always want our community to feel validated in seeking help, right? And when I was diagnosed, I always, you just have that moment, those moments that just stick in your mind forever, or little things. Like I always say that the divots in my skin from the hospital gown, I don't know, just those visuals. And what I really hoped for everybody was that all of the, cobbling together of brilliant individuals like yourself that I do on a daily on behalf of my community, that I could just serve the benefits that you guys provide to them, and they wouldn't have to go to the struggle to find people like I've had to in my health journey. I feel like I wasted a lot of time trying to get validated, a lot of time begging for labs, a lot of time saying, I'm glad you feel good about my health, but I feel like shit, right? To a practitioner. And then we land with people like yourself. And I go, oh my gosh, I've got to give you to my community. So I appreciate you giving them the hookup. We always are all about the hookup in our community. But I really also want to say that the fact that you guys incorporate looking at genetic expression, looking at the macro and micronutrient expression, and then we don't have to beg for labs. I mean, we're indoctrinated, you and I. It's just a given, right? Of course, we're going to look at chemistry in the body. The body's expressing something overtly. I mean, handfuls of hair. If it was handfuls of skin or handfuls of heart cells or handfuls of toes falling off, right? Maybe people would stand up and pay attention. But this is part of an extension of who we are from a health perspective. And I think that sometimes I'll say, just get those labs run. Let's look at the chemistry. And I see their face and I go, yeah, hold on. Let's help you get those labs run. Let's help you look at that chemistry.
Correct.
Because there is such a gap between the care that we need and the care that we deserve and the care that we're actually getting. So you guys do an exceptional job. And that's why I wanted to bring this into our community. Do you advocate supplementation?
Oh, yes. But once we get to the root cause of the hair loss.
Okay.
So
I love it.
if someone is not am out of balance on supplementation, then we're not going to advocate for that. However, that's one of the things, the reason that we like the epigenetic analysis that we use, because it does talk about whole foods and supplementation. So, I'm sure part of your community says, no, don't give me one more powder, one more pill, or something to take. Just tell me how to eat right. And if you tell me how to eat right, I can fix this. That's great if you can. But as you and I know, when you start getting to that trace level, you cannot eat enough of trace level minerals to be able to support what you need in your health.
This conversation, I love what you just said. We were talking about viral reactivation at the Institute the other day. And I was talking to one of our immunologists, and he was talking about how when a body gets under stress, it's almost like it comes up to this acute, stress episodic situation. And then instead of going back to its healthy homeostasis, it actually ends up in a whole nother valley. Mm-hmm. And he said, we can't eat our way or wish our way or will our way out of that valley. We've got to go back up the mountain and come back into the other side, which is your status in health or homeostasis. And I was like, it was so interesting because I thought about that. And, we obviously utilize a lot of targeted nutraceuticals and supplementation in our protocol, but it's like the body is lost in its ability to generate the health that it needs to. And so sometimes intervention needs to happen. Epigenetics, just because we are obsessed with that in our community. What types of gene expressions are you specifically looking for with hair loss? And maybe that's a whole nother show.
It would be, because there's 8.
There's 8. Oh, I love the number 8. Okay. Yeah. So there's 8 things. So you guys, it is not going to be a reductionistic way as long as you are still a dynamic human being having a biodiverse experience that is trying to unravel a complex issue. So we're going to bring you back to talk just about the epigenetic piece because our community is super, super fascinated. This is great. I love this. And our community is going to really love this. And so tell me one more time, and thank you for giving our people the hookup, but tell me one more time how people get a hold of you.
Yes. So our website is HPIHairPartners.com. And there's a consultation tab on the far right-hand side. It's quick. We only ask 5 questions because everyone's busy, right? But if there is a section for messages, and if just in the section, you would just list Haylie Pomroy or the first name and the last name, you can list anything you want. And then we'll make sure that one of my team members gets back to you, and then we'll get you scheduled for a full consultation and then get your hair loss journey in proactive mode versus reactive mode.
And if you noticed, I was looking down just a few minutes ago, I was texting one of my clients. So I'm like, you got to make a consultation before this goes live or you're never going to get in. But thank you. Thank you so much for being on. Our community is just, going to really be served by this episode. And that's my whole point or purpose for doing this. Is I do have the opportunity. It's my, while everybody's out working, right? All of your careers and your jobs, I'm out here. This is my job, is to find brilliant individuals like yourself to come back to our community and help us in our journey, be partners with us in our journey to make positive progress to, being well. So I just want to thank you so much for coming on. I really appreciate it. And please tell me you'll come on again. I want to talk about the thyroid. I want to talk about epigenetics.
Yes. And then don't forget, we'll also have to talk about our DNA expression testing too, that focuses on the right treatments for your hair loss.
Oh, that's nice. So it's customized. It's customized.
It is.
It's
completely. It's a total designer genetic expression.
It's the way all aspects of care should be. It's the way we have all of this knowledge. We should be using it for the good of our health every single day. Very exciting. We will do that for sure. Thank you so much for coming on. We'll talk soon.
Okay. Take care. Have a great day. Bye.